Good evening and welcome, Horizon House and other guests, to this very momentous occasion. I am Dr. Henry Kuharic, a retired internist and former clinical professor of medicine at the University of Washington, but I've been an advocate for health care for all for many, many years, and I think we're going to someday, very soon, get there, I hope. I'm grateful that we can. Thank you. I'm grateful that we have our I'm grateful that we can have our 43rd District Representative, Nicole Macri, with us tonight.
George?
Pardon me? This isn't coming through?
It is.
Okay. But I also want to introduce our
Lobbyist. Master of ceremony.
well, Cindy Laws, who's our lobbyist, and now I'm going to turn it over to Ronnie Scher, who is a pharmacist from Harborview, retired now, of course, and currently the president of Healthcare for All in Washington. Ronnie, it's yours.
Thank you, Henry. Thank you. It's so great to be here and see familiar faces and bring back the times when we were able to actually get together and see each other and ride a bus down to Olympia together. There was a bus that I think Lou Templeton reserved for us to all ride down to a lobby day in Olympia. Those times are still strong in my memory, despite the long years in between. So thanks to everyone, to Mary Margaret, Henry, Charlie Weems, and Seth, and for helping organize that, and all of strong supporters here. This is like a central place that Healthcare for All began. So thank you for joining us tonight. We're going to spend some of the evening with Nicole Macri talking about the present and future, but we'd like to really talk about what you've helped Healthcare for All do just this past year. Cindy Laws is a lobbyist who's going to share with you some of those exciting victories. Cindy has been with us. I think you've seen her a number of different times, and over the years, even a long time ago, she was a big part of this process of moving toward healthcare for all. So let me introduce our lobbyist, Cindy Laws, who's going to share some of these recent victories. And started out with 22 bills in 2022. So thank you.
Thank you so much. It's great to be back here. And as Ronnie said, I've been with Healthcare for All Washington for a long time. I was executive director from 1998 to 2000 when it was called Healthcare 2000. And we were we were putting together an initiative to go to the voters. And so it's been a long time, many big progress, things that we've done in the last 4 years. Over the last 4 years, we started with a bill called the Pathway to Universal Health Care. Nicole Macri was the prime sponsor of the House version of that bill. We passed the Senate version of that bill. And the Pathway bill, what was so important about that bill was that it established a work group that would then examine the various kinds of systems and put together some elements that they would agree on, this group agreed on. What was a second victory with the Pathway group was that there was 33 members of the group, and we got 6 people who were directly connected to Healthcare for All Washington. We got 6 people on that group. And then other people that we knew that were allies were on the group. So we knew going in that we had at least 18 of the 33 members were pro single payer. So that was a really helpful effort. And what we find with a lot of those kind of work groups is you really have to monitor them harshly, closely, tightly, to make sure they fit on what the language that was in the legislation that created the committee in the first place. It's always so important. You can't just, because you pass a bill, you can't just let it go. You have to stay on top. Are they doing what they're legislatively required to do? And they did. I mean, we had to stay on top of it. We had to keep working with the consultants that they hired to run the work group. Anyway, the next step in that, the year after that, we worked on some other stuff. That's when we started working on insulin. But then the second step in that pathway was that then we created a bill that created a Universal Health Care Commission. That actually is what we're doing now. We created this last year, passed a bill, this was in 2021, we passed a bill that created the actual commission, a commission of 6 people that is working on building the elements of what is going to be in a universal health care coverage plan. We didn't stop with that because of the 6 members. This was when I was hired and kept on over the summertime to put together, to study who do we want on this commission, knowing what the elements are, knowing how the governor does his appointments. And I studied really hard, looked out there for who are people that fit these elements, who are medical doctors that represent diversity of race, of age, of geography, of ethnicity, that type of thing. And of the 6 members of that committee, 5 of them came from us. 5 out of 6. It was phenomenal. And we didn't mind. The 6th person was one who had been on the Universal Healthcare Committee. I didn't think he was very active in the committee, but he was certainly a good person to be on this. So to say that we swept this, the Mariners would be begging for this kind of sweep. They're doing good. They're doing really well, but they would be begging for that kind of sweep. And so now they're putting together the work, and they will have to complete their first report at the end of November. And then they will report this to the legislature, and they'll continue working for another year. This is not new, and a lot of you will remember this. A lot of you will remember, and I had done my first internship in the legislature back in 1986. It's how sometimes I feel like I've been around a long time. I really have been around a long time. And in 1986, I was lucky to go down when I was considering changing careers. That my personal senator, I was living in Everett, my personal senator was Larry Wagmeld. And he said, well, why don't you come, before you go back and go to college to get a second degree, why don't you come spend a little money, come and do an internship with me. So I commuted 4 days a week from Everett to Olympia, drove, round trip, every day. And then went to work where I was a restaurant manager, and then I worked 50 hours a week as a restaurant manager. But when I get down to Olympia and I discover that my senator is the Senate Majority Leader. So it was a blessing, because I really got a great education at that time in working in the Majority Leader's office. 2 years later, the legislature passed the Basic Health Plan. It was a pilot project, and we passed that in 1988. We'd done this before. It was expanded with the Governor Booth Gardner created a health care commission, or under his administration, appointed the members to that, and a couple of people who were involved with Healthcare for All Washington, including Sherry Weinberg, monitored that and kept on top of that. Hal Stockbridge is another current member, has been one of the founding members of Healthcare for All Washington. He also tracked it. People that were on that commission as staffers and researchers, some of those people are still around. So it's really remarkable. We did this before, so that was passed again. That passed in 1993. And we had implemented a single-payer healthcare system in the state of Washington called the Basic Health Plan. The challenge is holding on to the majority so that it doesn't get gutted, as it did after the 1994 elections, and another party took control by a pretty good margin, and they, little by little, took things away from it, took things away until finally the whole thing was defunded when we hit the Great Recession of 2007 to 2009. It was completely defunded. It's still on the books though. So the key thing is we've been there before. We've walked this path before. So I have great hopes that it will continue to go forward. But this last year, my last year with lobbying for healthcare for Washington wasn't the intent, was my last year, but in the last session, we got on board with multiple of bills that we were looking at. There was a ton, I mean, there's always a lot of bills. Every year, there's several thousand pieces of legislation introduced in Olympia. And no matter how much the leaders of the four caucuses, the House Democrats, the Senate Democrats, the House Republicans, and the Senate Republicans, they all say the same thing. The leaders will all say, hold back. Don't introduce so many bills. And especially because it was pandemic. Well, nobody listens because everybody's got their bills to introduce. And there were some really great bills, but there was a ton of them this year. We got behind and helped successfully lobby 22 bills to passage in 2022. And what was really wonderful about this was that over the past 4 years, one of my big things to do to make sure that we can continue to make progress and we don't have the kind of massive rollbacks in legislation that we pass is to build consensus with Republicans. And sometimes people don't understand why I would put so much emphasis on working with Republicans. But healthcare affects everybody in every district. And when we look at the newspapers, we don't have, actually, the Seattle Times local newspaper does not cover healthcare nearly as good as other newspapers in the state do. Spokesman Review in Spokane has phenomenal coverage of healthcare, phenomenal reporting going on, phenomenal in the editorial page. The Yakima Herald Yakima Herald Republic newspaper also does really good coverage. In Chehalis, Centralia area, that paper there, they also do. And part of the reason they do is because they've had hospitals closed, they've had major clinics closed, and it's very hard for people to access healthcare in these areas. Other areas like Grace Harbor County, which is Aberdeen, Hoquiam, out on the coast, where they've also had clinics and hospitals close or threatened to close, they have other huge challenges. Some of the highest percentages of people that are on Medicaid are in Grace Harbor. It's one of the highest accesses of government-funded health care. And so it's a matter of reminding those legislators sometimes, you've got 65% of your people are on Medicare. Quit beating up on health care. People clearly need health care. And so this last session in particular, there was a couple of Republicans that were just truly have become good, solid votes, consistent votes for healthcare reform. And I hope that we can continue to look at these people as allies instead of enemies. And I think that's really important if we're going to go forward and be successful, is to, instead of looking at people as people to oppose, is to say, what do we have in common and how can we get them to come to the table? There will always be a few issues that will be straight partisan issues. And we did have a couple of those. So one of the bills that was prescient and important to pass was Mylyn Tai, representative from Mercer Island, 41st District. She introduced a bill to strengthen our commitment to abortion in the state of Washington. Talk about prescient. This is before the leak of the Supreme Court decision on Roe v. Wade. And so our bill strengthens things and protections for people who are seeking abortion. And that was a very good bill. It was one of those bills that passed on straight party lines, as we expected. There was a lot of debates. All these people who are running for re-election in the House that are running, you know, pretty much, excuse the expression, every ejaculation has to be saved, they would have to make their speeches so they'd have something to campaign on this fall. But this was one of those bills that was a really important bill to pass. So quickly run down some of the ones that we passed was, this is a bill that took a couple of years. Again, at the beginning of the pandemic in 2020, some of these bills had passed once before. And then the governor, at the time, it looked like, everything was shut down. We're going to have a couple of $1 billion shortfall in revenues, not realizing that when the federal stimulus happened and people would go spend all this thousands of dollars that they were getting, spending it right away. So we got actually a lot more money coming in than we expected. But the governor vetoed some of our bills because they had costs associated with them. And so he vetoed some of our health care bills that we had worked hard to pass in 2020. So we had to pass them again this year. And one of those was establishing a prescription drug affordability board. And this is a really important bill. It's going to impact lots of people. Everybody here, I'm sure, is on a prescription that costs a ton of money. And what we've seen over the years is there's a few things, and insulin was one of them, but there's a few drugs that the costs are skyrocketing, thousands of percent, more than 1,000% a year. And so this bill did get watered down quite a bit from where it started to. I was disappointed with how much it did get watered down, but still a really important bill. It will examine 24 drugs every year that have exceptional cost, and they'll be looking at that. And then the second part of that is what can be done to contain those costs. And so this is a big start on this one. Another one was about insulin affordability. And again, we had first passed this bill in 2020. We repassed it this year. We strengthened it. And part of it, when we passed the bill in 2020, we were able to get the copay on insulin down to $100 a month for copay. That was 2020. And again, when we talk about $100 a month, this was a drug that was created over 100 years ago. And the patent on the drug was given away because it was so important for people to have this drug. But then manufacturers got this drug, and this was a drug that the cost of this drug went up over 5,000% within the last 6 or 7 years. And so a drug that, literally cost a couple of bucks to make, they're selling it to people for thousands of dollars. We saw especially young people who did not figure out how to get involved in Medicaid, and they're eligible. They were rationing their insulin and dying in some cases, certainly making themselves very sick, and then showing up at the hospital and paying, racking up thousands of dollars, tens of thousands of dollars in some cases, in medical bills that taxpayers then have to pay. So this is a really important bill, and it also not only caps the cost of insulin now is only $35 a month, so a little more than $1 a day. So this is a good one, and this is a kind of a tactic that we had talked about back in 2019, I think it was 2019 or 2020, when Healthcare for Washington, we talked about what could we do while we're waiting for the Universal Healthcare Work Group to do its work. What else can we do to make a big impact in people's lives? And controlling drug costs is such a big and important one. So really proud of what we did there. So again, there's two bills. One was to creating the work group, an insulin work group. You may have heard that California, just last week, Governor Newsom announced that they were considering, they're going to look at creating their own insulin in the state of California. We started talking about that in 2020. We could either create our own or buy our own and market it our own, and we have a pilot project that it was based on. This isn't new. Back in the early 90s, Senator Karen Kaiser introduced a bill that created the childhood vaccination program. Parents of kids don't pay for vaccinations because of the childhood vaccination program. The state is able to buy these vaccinations in bulk, and they provide them to doctors and pharmacists, and they are able to vaccinate children for free because it's cheaper that way. It's cheaper. We can argue this from economic issue, if not for health issue, it's economics. Insulin's the same way. So we're looking at that. I'm glad that Governor Newsom's also raising this because we can have a West Coast consortium of buying. It'll be even better. One of the other big bills that we're proud of is about statewide spending on primary care. This bill was sponsored by Senator June Robinson, who represents Everett and 38th District. This is another big one. This bill was strongly supported by some great Republicans. I want to call out specifically Senator Ron Muzzall, who represents Whidbey Island, 10th District. He's a farmer. He's been a great guy to work with. I think we can look for good things from him in the future. So this one is about increasing the amount, we'll be monitoring and increasing the amount that's spent on primary care. And European nations, they spend 15% of all healthcare dollars are spent on primary care. In the United States, it's about 4%. You put money up front, you save money down the line. And so this is one of the things, again, from economics, it makes more sense. Spend more money on primary care, people won't get so sick later on. We had, and some of these sound really technical, it's with a lot of prescription ones. One was Senate Bill 5610, which is cost sharing, and this is against, so however, if you're working on Medicare Part D, and you're getting coupons and all this kind of stuff, the insurance companies and brokers, pharmacy brokers, were gaming the system so that you were having to pay more if you were getting coupons or discounts or whatever. Now, all of those things will have to go against your copay. So if you're getting a $100 coupon, that goes towards your copay. They can't keep jacking you around. So this is a good one. One of the ones of fairness was increasing board and commission capacity. So the state has dozens and dozens and dozens of boards and commissions and work groups and blah, blah, blah. One of the challenges is that the people on this time are often the same type of people. They kind of look the same, not a lot of diversity. And a lot of times what they're missing is people, and this has been something I have lobbied for consistently, not just on healthcare, but on other things I've worked on. The people that sit on boards and commissions have to involve people that are impacted by that. So if you're going to have an insulin work group, you better have people with diabetes on the work group, or people that are parents of a child with diabetes. You'd be surprised how hard I had to actually convince the sponsor of the insulin bill to accept that amendment. But she did, eventually. And now they know when I get up there and I'm going to talk about this. So I was really glad to see this come out. This bill was really important to get so that the people that are affected by something, any board or any commission, they're going to talk about that bill about cars. You're going to better have people that drive a car on that commission, whatever it might be. A big one that we really, I've got to wrap it up, right? So the big one that I'm super, super proud about. There are bills every year called agency request bills. The Wildlife Agency, Department of Natural Resources, Department of Health, whatever. People that head those agencies, they put forth things to the governor that they want to have this bill needs to get done. And this is because they see within the area that they're responsible for, this is things we have to fix, make better, expand, whatever it might be. One of these was charity care. Our Attorney General was seeing again and again that despite the fact that the state has a law for charity care, that hospitals were not following the law. And 18 hospitals were cited in a lawsuit that the Attorney General went against people like Providence who were not notifying people that they qualified for charity care. So you're showing up at triage at a hospital and you're getting peppered with all this questions about your insurance and da-da-da, and they weren't even notifying you might have qualified. So not only did we increase the Charity Care Act, it's now it expanded it. So people that are up to 400% of poverty level can get a discount on their health care. And if you're at 200% of poverty level, you're completely covered if you show up at a hospital. They have to tell you about this. This is a really big deal. What was important is I had testified in favor of this bill, and I had cited the Attorney General's lawsuit in doing so, and I named all of the cities that these hospitals were violating so that I could point out to those legislators sitting in those areas that it was their hospitals in their areas that are violating the law and their constituents were being harmed. The very afternoon, I got an email from the Attorney General's office asking us, Healthcare for Washington, to help them pass this bill. That was pretty darn a proud moment to work with the Attorney General's office to pass this bill. And so we coordinated for the next couple weeks on making sure this was one of those bills that was one of the last ones to pass. And so they held it up. You're sitting there, pins and needles, watching these long, long legislative sessions that would go into 6 o'clock in the morning. The legislators working all night long for a week, 2 weeks on end. And you're sitting there waiting, when is this bill going to come up? And it finally comes up and it passes. And so it was one of those, this was a bill that did pass with strong support, bipartisan support eventually, with a lot of lobbying with the Republicans to recognize that this was going to help their constituents. So we had a great year. We did big stuff, big stuff. It's coming about, and we will get to universal health care in your lifetime.
Thank you, Cindy, and please help me give a warm welcome or a warm thank you to Cindy for all the work she's done, and thank you to each of you for supporting and helping us bring people like Cindy to the front. And if you didn't remember everything that Cindy said, you have an opportunity to watch it on Horizon House Television next Tuesday at
7:30.
7:30. If you remember everything, there will be a question and answer. You can get ahead of your neighbors and answer the online question and answer for everything that Cindy shared with us, or just tell them to join us.
It's also on the website. You can go back and review all the stuff we've been doing.
And so now I'd like to introduce Nicole Macri, the representative who we elected from the 43rd District in 2016. And I think it was one of the best things that we have done. She has taken a lead in healthcare as a member and a former vice chair of the Health and Wellness Committee, and now still on that committee, but as the vice chair of the Appropriations Committee. It's like moving up. So I think we owe a warm welcome to Nicole Macri, who has represented our voices in Olympia. So, Nicole.
So, hopefully you can hear me. Can you hear me okay with this little lapel mic? It is such an honor to be back here at Horizon House and with all of you who are engaged with or interested in learning more about healthcare for all. Healthcare for All Washington has been an incredible advocate. You heard from Cindy that many folks have been working for many, many years to push for universal health care and specifically for publicly funded single-payer health care. And I think you all probably understand why we're trying to do that, right? There's too much profit in the healthcare system. The inflation rate of healthcare has exceeded the general inflation rate, meaning more and more cost burden on consumers and on employers. And our quality of health care is far below what we see in other countries. In fact, I recently read an article that compared several industrialized nations around the world and tracked COVID-related illness and death, and was able to pinpoint that if we had universal health care in the United States, as they do in many European nations, we likely would see 200,000 fewer COVID deaths in our country than we did see. So the pandemic has underscored the failings of our privatized healthcare system, or profit-driven healthcare system. Unfortunately, we still have a lot of advocacy to do. You would think that we would see this. You see this in the paper that we have a higher death rate related to COVID, and we have a higher hospitalization rate related to COVID than other countries. And why is that? You think that would motivate policymakers to look at improvements in our healthcare system, but because of those really strong corporate interests, the private insurance companies, and more the mega multi-state consolidated hospital-based healthcare systems, there is huge resistance. They have huge lobbying efforts happening in state legislatures and at the federal level. And so we have to really organize and fight hard to make improvements. So Cindy reviewed so many great policies that we have worked on. Another one, finally at the federal level, a couple of years ago, at the state level, we passed a prohibition on surprise billing, because insurance is such a convoluted endeavor. what was happening to too many patients is that they would go to, say, the hospital for a procedure. They would double check, make sure they got a referral to a surgeon who was in their network and covered fully by their insurance. And they thought they were great. But what they didn't realize is the radiologists at the hospital or the anesthesiologist at the hospital actually wasn't in their network, and they would get a surprise bill, often for thousands of dollars. And the insurance company would say, well, you chose an out-of-network provider, so it's on you to pay that. And there is no way that the patient would know this in advance. So in Washington, we passed a law prohibiting that and said, take the consumer, the patient out of it, and the provider and the insurance company would have to negotiate it out and figure out who is paying what. But we're no longer going to put that cost burden on the patient. Well, finally, at the federal level, they passed national legislation around surprise billing. So this year, we went back and we strengthened our own surprise billing law in Washington State to align with the new federal statute and to include surprise billing related to behavioral health related emergencies, which was a great improvement. So that's one other piece of legislation that we passed. So the charity care, surprise billing, and all the things that Cindy said. It was on the insulin front, we are still pursuing opportunities for how we can model after California, but one piece of legislation we did pass related to that is we said we sort of authorized our state healthcare authority to actually approach California to purchase their publicly financed, publicly created insulin. So we've been waiting for California to launch their program, and we're watching them as a model to see what we might be able to replicate here in Washington. But in the meantime, we set up a pathway where we could purchase more affordable insulin on behalf of Washington residents from California. They're literally building a factory to produce insulin in California. So that's been great. I've been part of a small group of legislators from Washington, Oregon, and California who have similar interests around universal health care. We've met a couple of times to compare notes about policy and look at interstate opportunities like this. And I think that is going to be a continuing exciting pathway. As Ronnie said, I'm a vice chair on the Appropriations Committee. And so while we've done a lot in the policy realm, I've really, in the last couple of years, tried to lead on the budget and how we are investing in healthcare. And one of the big developments from this past year is we've been working in order to move us towards a universal healthcare system. We need to make sure everybody has healthcare coverage, right? And right now, most people in Washington State have healthcare coverage, but not everybody does. And when COVID first hit and many people lost their jobs, we saw many people lose their insurance because their insurance was tied to their jobs. And we also saw that people were not able to purchase individual plans outside of their employment because they were too expensive. Thankfully, the federal government said, we're going to increase the tax credits for the Obamacare individual plans that people can buy outside of employment, and that really expanded the number of people who could get health insurance. They also said, we're going to suspend rolling people off of Medicaid. People can maintain, if they were eligible to get on Medicaid. Medicaid is insurance for low-income people in the United States, and through the Affordable Care Act about a decade ago, Medicaid was expanded significantly. It used to be relatively narrow who could get Medicaid. It was expanded significantly to be an income-based eligibility for all low-income people in our state. States can opt into the Medicaid program. I think right now we have 48 states who have opted in. There's a couple who are still holdouts on it. But through COVID, they said, you don't, if you lose your eligibility for Medicaid, if your income gets too high, you're not going to lose your Medicaid during COVID. People will have consistent insurance. And what we saw in Washington is that about 200,000 people got onto Medicaid, and they have maintained this low-income health insurance, which has provided a lot more access to care for folks. And as I said, they expanded the tax credits and subsidies for people who are low to moderate income who are buying individual plans. So we saw we initially saw a big drop off in the number of people who had insurance because they lost jobs. Thanks to federal legislation, we saw an increase in who had insurance. Unfortunately, those measures from the federal government are temporary. So when the public health emergency that we're currently in sunsets, which we're in the process of doing right now, we are going to see about a couple 100,000 people roll off of Medicaid in Washington State. And those increased tax credits and subsidies that brought those individual plans from about $200 to $300 a month down to about $50 a month in premium costs for folks. Those expire in December of 2022, so just in a few months, about 6 months. And so we are going to see, when we go back to legislative session in January, we're going to see many thousands of Washingtonians who are going to be in need of coverage. So the thing we need to do related to universal health care is, number one, to make sure as many people as possible have coverage. And while we have done a lot better in Washington State than many other states, we know we're facing this challenge going into 2023. And we need to make sure that we have equitable access, because coverage isn't the only thing. And what we found with the Affordable Care Act is that they expanded access to health insurance, but because they left it mostly as a private insurance scheme, we saw the deductibles go up. So they would price the plans so people could afford to buy them. But then when they would go to the doctor, they'd be hit with these really big bills because they had to meet these high deductibles. And in the US now, the average deductible is about $5,000. So you have to pay the first $5,000. And so this temporary COVID reduction made the higher quality plans with lower deductibles a lot more accessible to people. And that is what we're going to have to continue to push for at the federal level and look for ways the state can help in the meantime. And then the other thing we really need to do, and we have to make sure we have equitable access also just on the provider side, meaning we have to make sure that there are doctors and specialists of all types accessible to people at all income levels and across all areas of the state. We have challenges, particularly in our rural areas, with having access to providers. There are many counties within Washington State where there's not one psychiatrist in the entire county. Through COVID, we learned that telehealth can be a way that more people can get easier access to doctors because they can meet remotely over the computer with doctors. It's not always the same as an in-person visit, but really has expanded access for many people. So we have to, as a state, make sure we're investing in those pathways that create healthcare practitioners. So investing in our public university systems, like the University of Washington Medical School and Washington State University Medical School, to make sure that we can create equitable access to the full range of providers. And then the big thing that's not as sexy, I say, like when you send out a newsletter as a politician and you say, we expanded health insurance coverage to 100,000 people in Washington State, constituents are like, that's awesome. But when you say, we held hospitals accountable on their cost trends over time. People are like, snooze, I have no idea what you're talking about. But that is so essential, because what we see, particularly with hospital mergers, is that patients have, we're seeing these growing multi-state monopolies within healthcare, that consumers have been on the losing end of this, and healthcare costs, the price of healthcare, has gone up. And so part of the work that I've really focused on is how do we manage those costs of healthcare over time. And part of the work I've done is how do we shine a light on what the costs are. So what's the relationship between the charges that hospital-based health systems are making and the actual cost of delivering care? Because there's a lot of sort of hidden profit. Some of our hospital systems are struggling in the state. Cindy mentioned Grays Harbor County. I've met with the administrator from Yakima Memorial Hospital. That's another hospital that has a very high Medicaid population, and so a lot of low-income patients. And so there are hospitals in our state that are struggling financially, but there are hospitals in our state that are part of these mega systems where it is not transparent to policymakers how much money they're making. And they're investing in all sorts of hedge funds and involved in all sorts of business activities that are not related to healthcare to reap more financial profit. And so it becomes challenging to really understand the landscape. And so what I've done is work on some policies to really require more financial reporting and transparency, because we have to manage the costs of healthcare if we're going to make sure that healthcare is affordable to all Washingtonians. One of the most exciting budget things I've worked on this year is over the past few years, there have been a number of legislators working with advocates from around the state to expand coverage to immigrant residents of our state. So about a quarter of all uninsured people in our state are undocumented immigrant residents of the state. Because undocumented immigrants are both not eligible for public insurance like Medicaid, and they also are ineligible from using their own money from going on to the Health Benefits Exchange, or Washington Health Plan Finder program for individual plans. Undocumented immigrants are ineligible to use that platform because of how the ACA, the Affordable Care Act, was drafted. The negotiated agreement on that excluded those folks from buying plans even with their own money. And certainly they're not eligible for any of the tax credits or federal subsidies. So that leaves thousands, tens of thousands of people, about 100,000 people in our state with really basically no access to health care insurance. So we've been working with the governor's team on a strategy to expand coverage to immigrants in our state. And just today I submitted a letter signed by over 50 legislators in support of a federal waiver application our state has been put in to allow all residents, including immigrants, to buy health insurance plans on the exchange. And we budgeted for future years, once we hopefully get that waiver, state-based subsidies for folks to get those plans. So if people are low income, that the premiums will be affordable to them. So sort of mirroring what the federal government does for folks, but for immigrant residents who are ineligible for those federal subsidies, that we would provide a state-only subsidy. That we hope will provide access to health insurance for a large number of people. And what we know from COVID is that we saw disproportionate hospitalizations and deaths among immigrants in our state, particularly in Central Washington, in our farm worker community, because people didn't have health care coverage. So that's a big thing we did. And the other big investment I want to mention is our investment in foundational public health. When I came to the legislature in 2017, the state was investing about $3 or $4 million a year in foundational public health across the state. And it was a big deal when we increased funding a couple of years ago, before COVID, to like $12 million a year. It's woefully inadequate, right? COVID taught us that you need to have a robust public health system to be able to mobilize the kinds of interventions we need when there is a public health crisis. And so this past year, we increased the investment in foundational public health to $150 million and pushed for that funding to be ongoing over time, which will really strengthen the healthcare network. So while the healthcare delivery system is an important piece of it, the public health supports those vaccine drives, those COVID testing drives, those sorts of things are essential. The tuberculosis testing, the hepatitis C testing and treatment for people, these communicable diseases that can really destabilize communities, and they're coming at us. Monkeypox is a real thing. We're seeing a number of cases here in our region, and we need to have a public health response to that. So that investment in public health was another big advancement that we made recently. So I'll stop there. There's a lot of detail I can talk about in terms of healthcare, but all of these steps are moving us towards a more cohesive, affordable, equitable, accessible healthcare system in Washington State, and Healthcare for All Washington has been an essential partner in every step of the way. The advocacy, the mobilization, the testimony, the meetings with legislators, all has helped make a really big difference. That 52 signers I got on the letter that I drafted to the federal government for our waiver to expand healthcare coverage in Washington, those 50 or so colleagues of mine would not have said, yes, please sign me on, if they hadn't heard from their constituents, many of them associated with Healthcare for All Washington, that this is a priority for the people that they represent. So just want to thank you for the tremendous work that you all have done over the years to get us to this point. And with that, I'll turn it back over to Ronnie for Q&A.
Thank you. And please tell your friends to listen to Nicole again on Tuesday night if they missed it tonight. That's a really powerful information, and I think we deserve to give her a hand for moving on to take care of the appropriations issues. Those, I'm so glad I don't have to deal with those specifics. So thank you for doing all that. So now we can take some questions. Ann has a microphone over on that side, and I'm going to give Charlie this microphone to share with people on this side. Why don't you come on back up?
Hold on. It seems that the state does not have any power or authority to deal with the mergers of hospitals, and so we experience the loss of services. For example, our friends across the street will not talk to us about death and dying issues. Has there been any concern at the state level about these mergers that eliminate services?
Thank you for that question. Yes, this is a huge problem, and I was furious at the VM merger with the Franciscans, now called Virginia Mason Franciscan.
Money grubbers is what they're called, money grubbers.
And the Franciscans are another multi-state corporation, and we have the highest proportion of religiously affiliated hospital beds in Washington state. And that means our access to the full range of reproductive health care, including abortion care, gender affirming care, and end-of-life care are all in particular jeopardy. There is a bill that was introduced last year by Senator Emily Randall and Representative Tara Simmons, who represents Peter in the 23rd Legislative District over on Bay Ridge Island, called the Keep Our Care Act, that is would require additional scrutiny by the state and the state attorney general around mergers and acquisitions, both looking at access to the full range of care, including our state right to death with dignity care, and looking at the financial burdens a merger could have on patients in the region. The Hospital Association, unsurprisingly, fought very hard against that bill, and so we did not see it proceed. But particularly in light of the Dobbs Supreme Court decision which overturned Roe v. Wade, there is a lot of energy to work on that bill in the 23 session. It's a priority, particularly for reproductive health justice activists.
But they're lost and we can't regain them.
Yes, once they're gone, and we've seen too many mergers in Washington state. So we are looking at what are the opportunities to require hospitals who've already merged to provide the full range of access to care. I worked actually, to Cindy's point about bipartisanship, I worked very closely with a Republican representative from Walla Walla, Skylar Rude, on death with dignity issues. He represents a relatively rural district where there is very limited access to end-of-life care. And he had heard from some constituents in his district about a really terrible circumstance that their family went through when a loved one died, and they could not get access to the end-of-life care that they were looking for. And so he's really been pushing for the last 3 years, and I've been his key partner on a bill that will reduce barriers to the death with dignity rights that we have. And that includes, one of the things we hear from doctors who work for religiously affiliated institutions is that they worry about retaliation from their employer if they provide care for patients outside of their regular employment with the religiously affiliated institutions. And this bill that we've introduced would say providers, willing providers who are willing to provide that care on their own time cannot be retaliated against or disciplined by their employer. So it doesn't get at the issue with the institutions, but it's a way to make sure that that medical providers can still provide care in their communities. So that's just one piece, but it's an incredibly challenging issue, and one that's getting more attention and energy from legislators right now. So, and I think we thought we were immune to these issues in a relatively progressive area of the state with so much access. I mean, just here in this neighborhood, you know, we have so many healthcare providers, but when that merger between VM and the Franciscans occurred, it was a wake-up call, I think, for many, particularly Seattle area legislators. And thank you for raising that. We need to continue to fight on that front.
So one thing on that bill, so the bill, it's important to remember sometimes these are, that was a, sorry, it's got a microphone.
No, something happened.
Thank you.
Thank you, Charlie.
So that was a really important, there was two bills, again, one in the House, one in the Senate. It was Senate Bill 5688 in the Senate, 1809 in the House. This was a short legislative session this last year. And so this bill, called the nickname of it was Save Our Care Act, which is always hard when they have cute names that has nothing to do with what's actually the title of the bill, which is boring as heck. The title was Concerning Material Changes to the Operations and Governance Structure of Participants in the Healthcare Marketplace. So it's kind of hard to get people excited about that long title when Save Our Care Act is not found, as those four words are not found in anywhere in the bill. So, but it's important to remember, so in a short session you only have 60 days. And in the even numbered years, it's a 60-day session. So next year, hopefully, next year's a 105-day session. And so that extra 35 days makes 45 days makes a tremendous difference in what you can get done. And so we're trying to jam-pack all these bills through. And when there is strident opposition, in this case, this bill was not just opposed by the hospitals, but it was also opposed by, sadly, a lot of it, something I worked on is disability policy. And so a lot of disability activists jumped on the opposition to that bill. And this is when we have to do some education within some of the disability activists, because some of them are so strident that they're so against the Death with Dignity Act that anything that makes it easier for people to exceed that they're like, you're going to put people down for having, mental retardation or other kind of things like that. And it's hard. I have one of my close allies. I served on this. I was co-chair of the Seattle Disability Commission. One of my colleagues has a horrible form of MS, and he's a quadriplegic, and he's a very effective advocate against this bill. I work for Booth Gardner. I spent 4 years of my life working for Booth Gardner. And to the end of my days, I'm going to try to keep making sure that his legacy lives on, as he could not. But this is something we have to constantly look out for. We will need strong voices when this bill comes up again, and hopefully it'll have a better short title, but that will be a little more attractive. But we have to advocate hard for this kind of stuff. It's like, it's not sexy, but you have to fight hard for this. And now, because of Roe, it will make it a little easier. But it's not just Roe, it's not just abortion care, it's not just end of life, it's a lot of other stuff. Getting between, the primary thing, getting between the doctor and the patient and what they can even discuss. And so we should push a lot harder for something that's even stronger than Save Our Care Act. And make sure that we have to fight like hell for this kind of stuff. Great question, really great question. It was a big fight. We'll keep the fight going.
More questions?
Hi, I want to thank you for focusing on some of the hidden costs. I've been a very tepid supporter of single payer because I don't see that it automatically controls costs. And I wonder if you could elaborate, I'm with or without single payer, I wonder if you could elaborate on some of what you're learning, and I'm so appreciative to have you in the legislature, because I just think you're smart enough to look at these icky financial things and find out ways to save money.
Yeah. So
I think I have mine. I'll turn mine off. You talk first.
So this is one of the questions that was examined by the Pathway to Universal Healthcare work group. And there was lots of actuarial stuff done. In the first 2 years of implementing a universal healthcare system, it will save the state $3 billion a year. By year 5 through 7, it will save the state more than $5 billion per year. And it will continue to go up each year. The savings will go up. There's a lot of different reasons for that. One we talked to, why do you spend more money on primary care? Because it saves money down the road. Things like that. But you're also eliminating things like administrative stuff. You go into any doctor's office, how many clerks do they have in billing? There are more people in billing than there are delivering care. So that you eliminate a lot of that because there's just going to be one payer, the state. If they bill the state pays. And so you don't have to have, billing 20 different insurance agencies and so on and so forth. So there's things like that. You're taking out the profit. The healthcare profit is a huge margin. You're taking out marketing. How many commercials do you see for Virginia Mason? How many commercials do you see for Blue Cross? And on and on and on. You take out all that marketing, you put that dollars into care, it's going to save the state a lot of money. And it was in the actuarial studies, those things are, you can find the study. I think that some of the stuff is still on the website for Healthcare for All Washington, because we did track the reports that the Universal Healthcare Commission was doing. But it was substantially, billions and billions of dollars.
Nancy? Yeah, and I'll just add on to that. In the meantime, before we can get to that model, there are things we can do, and we have set up in our state a cost transparency board to look at these issues. So the number one thing is looking at the costs, collecting the data. So our state passed a bill to create what they have in a handful of states called the All Payers Claims Database. So part of the problem is we don't know. We don't know how much hospital systems and other healthcare entities are charging patients and charging patients with different kinds of coverage, right? So if you have Premera insurance, the hospital is maybe charging Premera $1,500 for an X-ray. But if you have Medicare coverage, the federal government will only pay $300 for that same service. And if you have state Medicaid, the Medicaid system maybe only pays $100 for that. So 3 different patients with 3 different kinds of coverage, all getting the same exact service, are being charged very different rates. And the healthcare entities say, well, this is all proprietary. It's negotiated with the insurance companies. We can't tell the patients what the charges are. And so we have passed legislation that will help us better understand what those charges are. And one of the challenges we have is because of all the different payers in healthcare, the commercial insurance, the Medicare, Medicaid, there's great, it's very convoluted, and it's confusing in the fact there's huge disparity. So most healthcare providers need to have what they call a mix of payers, because the Medicaid, they say Medicaid doesn't meet our costs, you pay too little, and so we cross-subsidize with commercial insurance. And when you have a single payer system, you just set the payment rates at a rational level that covers costs without driving huge profits. And so that is the model. There are things we can do short of a single payer system. And years ago we had in Washington basically rate matrices to set rates for different kinds of services, and that was eliminated, overturned through legislation many, many years ago. But there are a couple of states that still have it. I believe Massachusetts and Maryland still have that. And when we move forward with our Cascade Care, which is our public option on the individual market, we have delved into this idea of controlling costs by setting rates. So we set rates saying, if you're going to be in the network on a public option plan in Washington State through the Cascade Care, you can't charge more than 160% of what the Medicare payment rate is. And the docs and the hospitals all sort of lost it, saying, no way, you can't cap us, it has to be free market, blah, blah, blah. But what we're finding is by holding steady to that, we have more and more insurance plans wanting to participate in cascade care because they get the customer base, and then we have more and more hospitals and docs conforming to that rate structure. So you really need to have very strong will in the public policy realm to really make these kinds of reforms. It can happen, but you have to resist the very strong lobbying against it. So it's an excellent question. It's hard work because the battles can get pretty tough, but in the long run, you just have to be focused on the patients. And that's, I mean, I have so many meetings with hospitals and insurance companies where I just say, I don't care. I don't, like, I'm looking out for patients. The people who vote for me are the patients, and that's who we're gonna put first in this conversation. But we talked about the Roe decision. The Citizens United decision from several years ago is one of the most insidious decisions because it has allowed this free flow of corporate money into politics, and it has had a big influence on who elected officials listen to. And so that is the thing that we need to resist. So we are fortunate in a district like the 43rd legislative district that isn't a hotbed of political battles like some of our swing district areas, where the hospitals know, well, Macri's going to listen to the patients, and we're just not going to get the traction with her. So building that sphere of influence of people who can be insulated from the huge millions of dollars of corporate dollars in politics is really key as well.
I had a question. How much of the healthcare dollar is being spent on prevention? Because I know primary care is absolutely essential, but I'm not hearing much said about prevention.
Yeah, I don't know the figures on that, but very little, and definitely not enough. Our healthcare system, because of how it's structured, is far more reactive than in other countries around the world. It's a huge problem. It's a good issue to raise.
Primary care is only 5%.
The primary care is only 5%, and we set a goal through this legislation to get it to 14%. Of the total healthcare spend. And what we know is the more you spend in primary care, the more prevention you're essentially doing, because you're engaging with patients and catching things before they become huge challenges.
This may be a stupid question, but I don't understand position 1, position 2 in the pamphlet.
Oh, yeah, just there are just 2 representatives in every district, and so one of them is in position 1 and one of them is in position 2. It doesn't mean anything related to their standing in the legislature or their tenure, how long they've served. It's just how they assign the seat. So I hold position 1, and that is just because that was the seat that had opened up. So the people like Jamie Peterson, when he was in the House, he was in position 1. When Ed Murray was in the House, he was in position 1. Frank Chapp has been in position 2 for about 30 years now, 28 or 30 years. So he's had that, but Frank Chapp's had that position too for a really long time. But it's just like 1 and 2, they just number it. It's a good question.
I'm holding the microphone, so I'm sort of taking advantage of that. But one of the things that occurs to me about cost is that whenever I was working with the Healthcare for All group a long time ago and looking at that issue, looking at Medicare and the fact that it is the largest provider with the VA of publicly funded health care, and what their administrative percentage was relative to what was spent on care was light years apart from any major other database that we could find. So it's a good way of looking at what's possible if you have a single payer approach to the problem. The second comment was, will some of your foundational public health go into prevention, will go into the sort of things that Nancy was talking about in terms of beefing up the capacity of the public health system to address those prevention efforts?
Yeah, indeed, that is what it is intended to do. A lot of public health is around preventing illness, right? So the things like vaccine drives, et cetera, routine testing for certain communicable diseases, all of those things are intended to head off issues. And we're seeing a lot of advancements in diagnostics now, just incredible. The science is just amazing, and the public policy hasn't caught up with it yet. So a lot of the insurance companies are resistant. They say it costs money to do all these diagnostics, even if you know that if you can catch a disease early, you can really manage it and reduce the cost of treatment over time. And so there's a lot of debate about how and when diagnostics are covered, right? Like, how often does your insurance plan cover colonoscopies or mammograms or all those preventative tests that are recommended?
Well, did you have a question?
Yeah.
I have said for a long time that I think the 43rd Legislative District has the finest 3 legislators, and I appreciate your activeness on so many justice issues that are important to me personally, in addition to health care. I particularly want to thank you for your advocacy for the non-documented residents among us, and I know as director of the Downtown Emergency Service Center, this has been a life commitment and not just a legislative commitment for you. It does not make sense for us to make it so difficult for them, because if I am undocumented and I have tuberculosis, I'm going to share the bus, the store, the movie with you. And no matter how much health care you have, well, anyway, you know that. And so I would like to know if there are ways besides keeping on electing you that we should be advocating for your priorities.
That seems like a softball question, because we're here with a Healthcare for All. I mean, they really are a great organization because they are sending out the routine emails about what the priority issues are related to healthcare. And I would say there are many other organizations that are working on sort of related justice issues. The Washington Immigrant Solidarity Network is a great organization that has been a key partner in what we call the Health Equity Campaign, which is around extending health coverage for undocumented people in this state. They also have worked hard to protect the rights of immigrant workers in our state, and so that's another great organization. So I always suggest that you find that issue area that you're most passionate about, and you get connected with that organization. You know, the League of Women Voters has co-hosted a lot of our legislative forums and open candidate forums that we've done here at Horizon House, and they are particularly focused on key issues of justice that many people are interested in, related to criminal justice reform, related to climate change, related to gun safety. And so the League of Women Voters is another great organization to help keep informed about what some of the top issues are.
So I'll take that opportunity to pitch some of the challenges that we've had with Healthcare for All Washington. So there are now very few citizen-based, truly grassroots lobbying organizations in Olympia that lobby on healthcare. Healthcare for Washington was founded in 1994, and previously there was another organization. Craig Salins had started up I'm trying to remember what it was called, Single Payer Action Network. And that was when I used to work in this U.S. Senate, and I remember him coming and lobbying, in the U.S. Senate for this is something we needed to push. But I can tell you, and I actually testified about this one time, I had tallied up what I was paid by Healthcare for Washington, which is supported by grassroots people, against all the people that were lobbying against the hospital bill. And what they were paid, and it's public because we as lobbyists have to report, what we're paid each month. And so here was my little figure, and it was 32 to 1. $32 from the health insurance hospital people for every dollar that I was getting. And so that was the kind of thing about how important it is to support organizations like this one, because we're one of the only ones left that's doing this work. And so that's how important it is. It's great. We need to lobby Nicole, and like Nicole mentioned, she's supported strongly in this district. But we have to send our message to other parts of the state. And that's where, working where we built these allies with Skylar Root, as she mentioned. Mike Steele, who represents the 12th district, which is Chelan. He lives up in Chelan. We've made great contacts with Ron Muzzle up in Whidbey Island. I've even got good connections with people who have not necessarily voted with us a lot, but we're surprisingly strong. So in Northeast Washington, the insulin bill was co-sponsored, was prime sponsored. Then Chair Eileen Cody gave the bill to Jacqueline Maycumber, whose infant kid, she was in the legislature when her kid had to go to the emergency room. It turned out had type 1 diabetes, her infant. She used to represent the pharmaceutical industry. And then she, was kind of an example how when it hits you, it hits you. And she became a phenomenal advocate for and the sponsor of our insulin, our insulin bills. Joe Schmick, who is one of the Republican leaders, longtime representative, also he's a wheat farmer out in Northeast Washington. Good guy. He's part of the diabetes caucus. He's got diabetes himself. And so it's when we support organizations like Healthcare for Washington, we're able to spend the time getting to know these people one-on-one. And we look for other supporters of ours, we find them, we groom them, and your help with us helps us do that work. So we can find these people that think like you, but they're kind of isolated. They don't have the kind of facilities like this. They don't have these wonderful assisted living facilities out there like this, out in Colfax. They just don't. And so, but we're able to find stuff. We published, the last couple of years, we published 7 editorials in newspapers around the state. We didn't just work to get them in Seattle. We got them in places where we needed to get the legislative support. So we published them in Eastern Washington, and we published them in Southwest Washington, and we got that work done. And that's what the kind of work, when you support Healthcare for Washington, we're able to do that kind of work. And so it's really important. And it's not just, healthcare, but like I said, this is one of the only grassroots, truly grassroots, people-based organizations that's out there. And it's only got 2 professional staff. One was me, part-time, and one's the person who's very part-time who does the website. That's it. Everything else is the volunteers and you people supporting it. So that's what it does. It makes a big difference. And so then we can go, and we know who our champions are.
Where are the applications?
So there are some newsletters in the back of the room. And,
Thank you.
And just go to our website and you can find that information. So I think what Nicole and Cindy are saying is thank you for taking your time. They couldn't be doing this job without you. We wouldn't have an organization like Healthcare for All Washington without you. So thanks for taking this time tonight. Appreciate. So thank Nicole and Cindy, but thank you, Seth, too. Thank you very much.